So the ACL, or anterior cruciate ligament, is one of the main stabilizing ligaments of the knee. It connects the leg bone to the thigh bone. Its main function is to stop the leg bone coming forward on the thigh bone, but also helps to control inward rotation of the leg bone on the thigh bone. It's important, particularly when we perform pivoting movements, such as the movements we perform whilst playing multi-directional sport, like football, hockey, netball, rugby, to name a few. When it's torn or injured or not functioning well, the knee can feel unstable, where the knee can give way, or the individual can have a sensation of not trusting their knee joint when they are turning on their knee. That can result in the knee collapsing underneath them, which can be very painful and can lead to further damage to the knee joint. It can be possible for an individual to function at a very high level without an anterior cruciate ligament. However, a lot of individuals, particularly sporty individuals who would like to get back to multi-directional activities, may find it very difficult to return to their former sport without having a procedure called an anterior cruciate ligament reconstruction, which is aimed at restoring front to back, or what we call anterior posterior stability, as well as rotational stability of the knee joint. Following an anterior cruciate ligament injury, the knee can be very painful. It's often very swollen. It can be difficult to weight bear on, and there can at times be associated injuries along with the ACL rupture, for example, a meniscal tear. So the timing of surgery is really important. It's important to allow the knee to settle down, to regain its full range of motion, and to start getting good muscle activation, which we would call prehabilitation. And that often involves help from a physiotherapist who's trained in restoring function to the knee before we embark on surgery. So, timing is very crucial. I always recommend that we don't rush into surgery, but, as long as we obtain a knee that can bend and straighten well, and we have reasonably good muscle control, I think it's appropriate to then proceed to the surgery. Obviously, if there is a torn meniscus, it's important that we try and restore or repair the meniscus at the same time as restoring stability to the knee whilst performing an ACL reconstruction. There are several different techniques which can be utilized when performing a ACL reconstruction. The most commonly used technique is to take some tissue from around the knee, which is called an autograft. And the most common autograft tissues to be used are hamstring tendons or the patella tendon. And increasingly, quadriceps tendon is also being used as a graft for ACL reconstruction. Tissue can also be borrowed or from someone who's donated their tendons, and that's called allograft. And in certain circumstances, synthetic tissue has also been used.